Good afternoon, and thank you all for coming. Today, we're very pleased to announce that Conemaugh Memorial has attained chest pain center accreditation from the Society of Cardiovascular Patient Care. An odd name, but that is the accrediting arm of the American College of Cardiology. Heart attacks happen anytime, any place, and unfortunately to anyone. And we know that when they happen, every minute matters. And today, thanks to a year of really hard work, rigorous preparation, Conemaugh Memorial is better prepared than ever to offer life-saving emergency care. This journey did not come without a lot of hard work and effort by many. And to tell you more about this rigorous journey, I'm going to invite Dr. Bob Stenberg, who's the chief of our Division of Cardiology, to the podium. Bob.
Okay, thank you, and greetings to everybody that's here. I just wanted to say that it has been a really worthwhile endeavor. Our chest pain quality improvement project, it's really been ongoing really for a long time, many years. Of course, we all recognize that heart disease is the leading cause of death in the U.S., and in particular, heart attacks are acute coronary emergencies. That's a major health problem, and certainly the most threatening aspect of coronary disease or heart disease in the U.S. And we want the community, our community, and elsewhere to be aware of the warning signs of a heart attack. I know there's a lot of education efforts that are ongoing, even within our own staff here at Conemaugh Memorial. All the staff have completed education on early heart attack care, so that's a focus with our employees. This chest pain center accreditation is really a relatively select group of hospitals that we join. It's only a small percentage of hospitals across the U.S. that have this certification, and for the community members, just to kind of let you know what this is. We've been working on quality for our emergency cardiac care for really almost 15 years now. So it's we've had a quality improvement process in place. But what this accreditation basically means, it's essentially recognition from the outside that your organization has achieved a certain level of quality, you know, that we can document and demonstrate. And you know, with all the changes going on in healthcare, I mean, it's understandable that people, you know, patients, employees, all of us are sort of sometimes confused and not knowing really what's going to happen in healthcare. But I just want you to know, this is, again, especially for the members of the community, that there is a group of people, doctors and nurses and techs and medics and so forth that are really dedicated to try to make this a really good acute cardiac care center. I mean, it's a resource to the community. We try to protect the community from when they do experience cardiac emergencies. So I think we're like the medical equivalent of our trauma program. You know, people have bad things happen to them all of a sudden, and it's really nice to know that you have a capable, qualified facility and team that's there to help out if you or one of your loved ones has an emergency. So just to finish up, a special thanks to Marcy Duffy, the head of the cardiovascular service line. She put in a tremendous amount of time on this accreditation effort. Liz and Nicodemus from the ER, same thing, just tremendous time investment. So thanks to those individuals. And of course, the accreditation is just part of an ongoing process. I mean, it's not like something you achieve and then you're done. It's a continuous ongoing journey. So we'll continue to meet. We meet virtually every month and discuss this program that we have. So we'll continue to try to do better, just you know, each and every month and each and every year. So at this time, I'd like to ask Dr. Matt Perry from the emergency room to come up to the podium, and he'll It'll give some perspective from the emergency department side of things.
Thanks, Dr. Stenberg. Thank you all for coming. More than 5 million Americans visit hospitals each year with chest pain. Our goal as a certified chest pain center is to raise awareness, reduce the mortality rate of these patients by teaching the public to recognize and react to early signs and symptoms, therefore reducing the time that it takes to get for treatment. And also increase the accuracy and effectiveness of our treatment. Many times patients wait prior to presentation, and that can be a mistake. On average, it takes about 2 hours for patients to present to the emergency department after the onset of symptoms. And what they don't realize is that the earlier that they're treated, their outcomes can be so much better. We all use a term that time is myocardium, and truly time is heart muscle. So the earlier folks can recognize the symptoms, present sooner, and be treated sooner, their outcomes can be much better. One of our most crucial partners in this effort is our EMS community, thanks to Storm Nagel and all of our EMS providers, many of whom are here today. Some of the most critical moments in emergency cardiac care occur before the patients even reach our hospital. Today, we'd like to personally thank our EMS community for their important role they play in saving lives. We appreciate your ongoing collaboration, your support of our hospital, and most importantly, your unwavering commitment to serving the healthcare needs of our community. Together, we are raising the benchmark for emergency heart care in our community. I'll ask my colleagues to join me in handing out a plaque recognizing each EMS company's contribution for our chest pain accreditation.